In the military ER of Martin Army Community Hospital at Fort Benning, Nurse Madison Cole is invisible by choice. She keeps her head down, her answers short, and her past buried under 2 years of quiet shifts and unremarkable paperwork. But the chief physician, Dr. Gerald Mast, has made her invisibility his personal project, reminding the entire staff at every opportunity that a woman with a community college degree and no military rank has no business working in a corridor full of warriors. Then a training accident brings 8 Army Rangers through those doors, broken and bleeding. And the kind of injuries arriving on those stretchers are not the kind found in any civilian textbook. They are the kind that only someone who has been in the field downrange in the dirt knows how to read. Madison knows exactly what she is looking at. What no one in that ER is prepared for is the moment one of the Rangers on the table, bleeding out and fading, opens his eyes, looks at her face, and says a name that is not on her badge. Some secrets do not stay buried. Some of them walk back in through the trauma bay doors on a stretcher and blow the roof off everything you built to hide them. If this story moves you, hit that like button before you go. Every tap helps this channel reach someone who needs to hear it. The first thing Madison Cole did every morning before her shift was check the exits. Not obviously, not the way a nervous person checks them. The way someone trained to do it checks them. A single slow pass of the eyes across a room, 1 second, maybe 2. Doors, windows, blind corners, structural columns, everything cataloged, filed, forgotten. It was not a habit she had chosen. It was a habit that had chosen her. Somewhere between Kandahar and the 10 years she spent pretending Kandahar had never happened. Martin Army Community Hospital sat 12 minutes from the main gate of Fort Benning, Georgia. It was not a glamorous assignment for a nurse. It was not a teaching hospital. It was not a level 1 trauma center with a research program and a published faculty. It was a busy, underfunded military treatment facility that smelled like industrial cleaner and burnt coffee and processed a steady stream of active duty soldiers, their families, and the particular category of human damage that comes from training men to do violent things and then being surprised when the training goes wrong. Madison had been here for 2 years. She had chosen it the same way she chose everything in her civilian life. Carefully, quietly, for reasons she did not explain to anyone. She was 34 years old, 5 foot 5 inches tall, compact without being small, the kind of build that looked unremarkable in scrubs, but was something else entirely without them. Ash blonde hair, always pinned back, never a strand loose during shift. Eyes the color of winter sky over a mountain range. Pale gray blue, the kind of color that did not give much away. A thin scar along the left side of her jaw that she had stopped explaining years ago. A burn mark on her right forearm faded to a dull pink. She wore her badge clipped to her chest pocket the way everyone did. It said RN, her name, her unit, nothing else. Her scrubs were bright blue, always clean. She was standing at the nursing station at 6:30 when Dr. Gerald Mast walked through the automatic doors with his coffee and his opinions and the expression of a man who had decided decades ago that his opinions were the same as facts. Mast was 61 years old, former Army, retired colonel, orthopedic surgeon, Department of Defense, civilian contractor, cycling back through the MTF system for the 3rd time in 8 years because nobody with his credentials wanted to stay at a place like this for long. He was not a bad surgeon. Madison had watched him work. He was precise, methodical, technically competent in the way that a man who has done a thing 10,000 times is competent. He was also the kind of man who had spent 40 years in a world where rank determined value and who had translated that belief almost surgically into every civilian room he had ever walked into. He did not like Madison. He had never said so directly. Men like Mast rarely said things directly. They said them sideways in front of other people with enough plausible deniability that you could never quite pin the blade to the hand that was holding it. He passed the nursing station without looking at her. Cole, he said her name the way you say a word you are not sure belongs in the sentence. Dr. Mast, bed 4 had a potassium flag at 4 a.m. I do not see a note. I documented in the system at 4:42. Attending was notified. Intervention was completed by 4:30. There is a follow-up lab ordered for 700. He stopped, turned halfway, looked at her over his shoulder the way you look at something that has surprised you by doing something correctly. I did not see the note. It is there. A pause. He turned back toward the corridor. Make sure your documentation is visible. Some of us do not have time to go hunting. He walked away. Madison watched him go. She did not say anything. She had stopped saying things to Mast approximately 18 months ago when she realized that saying things gave him more material to work with and not saying things gave her more energy to spend on the actual work. It was a trade she had made cleanly and without regret. The nursing station was busy. Jenna Reyes, the charge nurse, was 3 monitors to Madison's left, typing fast, a ponytail swinging behind her head. Jenna was 29, good at her job, and had developed the habit of making eye contact with Madison after massed interactions. The way a person checks the road after a near miss. You okay? Just with her eyebrows. Madison always answered the same way, a small lift of her chin, barely perceptible. I'm fine. She was always fine. That was the thing about Madison Cole that most people at Martin Army had quietly decided was either impressive or unsettling depending on the day. Nothing touched her. Not mass comments, not the difficult admissions, not the nights when 3 trauma bays ran simultaneously and the entire department moved at the edge of controlled chaos. She moved through all of it the same way, steady, deliberate, economical, like a machine that had been calibrated for exactly this kind of pressure and ran cleanest when everything else was breaking down. What nobody here knew was why. The shift opened quiet, 2 post-op recoveries from the previous night, a dependent spouse with a blood pressure issue, mild, resolved with medication adjustment, a specialist from the infantry battalion 2 miles east with a hand injury that turned out to be a fracture, not a sprain. A distinction his squad leader had apparently been arguing with him about for 3 days before someone made the appointment. Madison processed the fracture, assisted with imaging, updated the chart, and had moved on to her next patient before the specialist finished signing his discharge paperwork. At 8:15, Mass stopped her in the corridor outside the supply room. He was not alone. 2 medical residents were with him. Young men, early 30s, matching expressions of people who were not sure if they were supposed to be watching. Cole, he did not wait for her to respond. The 700 potassium result, it was still low. Did you follow up? I called the attending at 7:03. New order was placed at 7:11. Replacement is running now. You called Dr. Yancey directly. Yes, without going through me first. Madison looked at him. The protocol for electrolyte management goes through the attending of record. Dr. Yancey is attending of record for bed 4. I am the senior physician in this department. You are the senior orthopedic surgeon in this department. Dr. Yancey is internal medicine. The protocol, I am aware of the protocol. Cole, his voice dropped. Not quiet or colder. What I am pointing out is that in this department, communication goes through the hierarchy, not around it. The shift. She had seen it before. The shift. She had seen it before. The pivot from conversation to performance. Community college programs do not always cover institutional communication structures the way 4-year programs do. It is not a criticism, it is a gap. Some nurses need more time to adjust to high-function environments. One of the residents looked at the floor. Madison said nothing. She had learned in another life a long time ago that there are 2 ways to respond to a man who is trying to reduce you in front of an audience. You can respond to what he said, or you can respond to what he is afraid of. Mast was not afraid of Madison's nursing degree. He was afraid of the fact that she was better at reading a trauma situation in 3 seconds than he was in 3 minutes, and that everyone in the department had started to notice, and that he could not explain it, and that inexplicable competence in someone he had dismissed was the kind of thing that kept men like him up at night. She did not say any of that. She said, I will review the communication protocol again, doctor, and she walked away. Behind her, she heard one of the residents say something low. She did not catch the words. She did not need to. She knew the tone. The same tone she had heard in briefing rooms and forward operating bases and aircraft cargo bays for 10 years before she ever put on scrubs. The tone of someone watching something happen and not knowing what to do about it. The door to the supply room closed behind her. She stood inside for 30 seconds. In the dark, her hands were steady. They were always steady. At 9:17, the radio at the nursing station came alive. Madison heard it from 2 rooms away. Not the words, the frequency of it, the clipped cadence of emergency dispatch, the particular rhythm of words arriving faster than normal, harder than normal, the cadence of people reporting something they did not have a category for yet. She was back at the station in 12 seconds. The charge nurse, Jenna, was standing with both hands on the counter, the radio receiver lifted halfway to her ear, her face doing something Madison had not seen it do before. "How many?" Jenna said. The voice on the other end said a number. Jenna put the receiver down. She turned and looked at the room. The room looked back. 8, she said. Training accident at Harmony Church. Explosion. 8 Rangers. Multiple critical. ETA 11 minutes. The room shifted. Madison felt it happen the way you feel a pressure change before a storm. Not a sound, not a movement. A change in the density of the air. The way people in the room suddenly occupied their bodies differently, more heavily, more urgently. She was already moving. She was already calculating. 8 Rangers from a live fire exercise. Harmony Church was a training area 6 miles east. Explosion meant blast injuries. Blast injuries meant tympanic membrane damage, pulmonary contusion, fragmentation wounds, traumatic brain injury, possible amputations. 8 men, 11 minutes. She pulled the emergency supply cart from the alcove and began staging. Chest seals, hemostatic gauze, tourniquet stock. She checked the crash cart nearest to Bay 3. She checked the defibrillator charge. She moved to Bay 5 and verified the airway kit, confirmed the laryngoscope blades, checked the ETI tube sizes. Mast appeared in the trauma bay doorway. "Who authorized staging?" Jenna answered from behind him. "Mass casualty protocol, doctor. 8 inbound. I am aware." "I am asking who authorized the staging in bays 3 through 6. Madison looked up from the airway kit. "I started it. Protocol says the charge nurse or attending initiates mass casualty staging. Not floor nurses." He walked into the bay. "Restack that in the proper sequence, Miller." He pointed at one of the residents. "Take over the airway kit, Cole." He looked at her. "Patient coordination. Keep the families calm when they arrive. That is where you will be most useful." Jenna's jaw tightened. Madison put down the laryngoscope handle. She did not argue. She did not argue because she had learned in environments where arguing cost time that the argument was never the point. The outcome was the point. And the outcome was 8 Rangers 11 minutes out and a trauma team that needed to be ready. She moved to the coordination desk. She pulled up the board. She began assigning bays. She began making calls. She called the blood bank. She called the OR scheduling coordinator and told them to clear 2 suites and hold 2 more pending. She called pharmacy. She called the trauma surgeon on call, a Dr. Hennessy whom she had worked with twice and who was, unlike Mass, the kind of person who asked questions and listened to the answers. Mass watched her from the bay doorway. He said nothing. At 9:28, the first ambulance arrived. Madison heard it before she saw it. The change in sound outside the double doors, engines, voices, the percussion of stretcher wheels on pavement. She was already gloved. She was already at the bay entrance. The first stretcher came through the doors, and she saw the man on it, and her body did something before her mind did. It recognized him, not his face, his injuries. The pattern of them, the location of the fragmentation wounds, the angle of the trauma, the specific distribution of blast damage across his torso and upper extremities. She knew this pattern. She had seen it before. She had treated it before in a field in the dark with equipment that cost a fraction of what was available in this room, with hands that shook for the first time in years. Her hands were not shaking now. The soldier was conscious barely. His eyes were open, rolling, trying to fix on something stable. His left arm was tourniqueted above the elbow. His right side showed the ragged lateral tears of fragmentation, 3 visible entry points, no exits, which meant the fragments were still in him, which meant the damage was still being cataloged by his body and had not finished announcing itself. His lips moved. Madison leaned in. She could not stop herself. She leaned in the way you lean in when someone is saying something in a language you spent years learning and have spent years trying to forget. His lips moved again. She heard it. 2 syllables. Not a word from his chart, not a name from his file. A word that belonged to a different time, a different place, a different version of the woman standing over him in bright blue scrubs with a hospital badge clipped to her chest pocket. A word that no one in this building was supposed to know. He said, Hawk, and Madison Cole's hands for the first time in 2 years did not move. The word landed like a stone dropped into still water. Hawk. Madison straightened up. One breath, two. The soldier's eyes were closing. His blood pressure was dropping. She could see it in the color of his lips, the way the muscles in his face were going slack, the particular looseness of a body that is beginning to negotiate with its own limits. She moved, not because she decided to, because her body had already decided, and her mind caught up half a second later, the way it always had, the way 10 years of training had wired it to catch up fast and clean and without the luxury of hesitation. His pressure is crashing. She said it to the room. Not loud, loud enough. Left side breast sounds are absent. Tension pneumo. He needs needle decompression. Now, Dr. Miller, the resident, looked up from the airway kit across the bay. He looked at the monitor. He looked at the patient. He looked back at the monitor. The sequence took 4 seconds. 4 seconds was too long. Get me a 14 gauge. Madison was already at the supply card. Her hand found the angio cath before the sentence finished. Someone call it out. Jenna called it. BP 70 over palp. Sats dropping 78%. Miller stepped forward. He had the needle in his hand. He was looking at the patient's chest. Madison could see him calculating. Second intercostal space, mid-clavicular line. She had done this calculation herself more times than she could count in conditions where the math had to be right on the first try because there was no second try. He hesitated. Not long, a fraction of a second, but she saw it. Mast appeared in the bay doorway. Miller, proceed. Miller moved. He found the landmark. He inserted the needle. Wrong angle. Madison saw it happen. The angle was off by 15 degrees lateral instead of perpendicular, which meant it would miss the pleural space or skip off the rib and accomplish nothing while the man on the table continued to suffocate in his own chest cavity. She put her hand over Miller's, not forceful, precise, corrected the angle in one motion, perpendicular, second intercostal. She advanced the needle. The hiss of escaping air was immediate, a rush of pressure releasing, the sound of a chest unlocking. The monitor changed. Sats climbing, 78 to 83, 87, 91. The soldier's color shifted. Something came back into his face. Miller looked at his own hand, then at Madison. What was that? Mass said. Madison pulled back from the bed. She stripped her glove. He is stabilizing. He needs imaging for the fragmentation. Right lateral chest minimum 3 views, and someone needs to check his tympanic membranes. Blast exposure at close range. I asked you a question, Cole. She looked at Mast. The angle was off, she said. I corrected it. You interfered with a physician's procedure. I corrected the angle. The needle would have missed. That is not your call to make. The monitor behind them beeped. Stable now, 94% and climbing. The patient's chest rising and falling in the rhythm of a man who had just been given back the air his body had been losing. Mast looked at the monitor. He looked at the patient. He looked at Madison with an expression she recognized. The expression of a man who knows he cannot argue with the outcome, but has not decided what to do with that knowledge yet. Get out of this bay, he said. Now, Jenna stepped forward. Doctor, we have 7 more inbound. I set out. Madison walked out of the bay. She did not run. She did not argue. She walked to the corridor and stood with her back to the wall and took 3 breaths and listened to the sounds of the department reorganizing itself around the incoming mass casualty. And she thought about the word the soldier had said, Hawk, her call sign, from the 1st Battalion, 75th Ranger Regiment, from the years she did not talk about, from a version of herself that wore multicam instead of scrubs and moved through the world at a different speed and with a different set of permissions. She had chosen Madison Cole the way you choose a door carefully because it led somewhere different. Because different was the only option after the things she had seen in the Korengal Valley in 2019. After the ambush that took 4 members of her support element, after the debrief that lasted 6 hours and the silence that lasted considerably longer. She had become a nurse because medicine was the only language she knew that translated. She had come to Fort Benning because she thought proximity was manageable, that she could work near the world without being in it, that she could keep the door shut. The second stretcher came through the trauma bay doors, then the third, then the fourth, fifth, sixth, in a compressed burst of motion and sound, in the particular organized chaos of a mass casualty arrival where everyone is moving fast and the variables are still being counted. Madison watched from the corridor. She watched mass direct traffic with the confidence of a man who had run trauma bays before. He was not incompetent. She needed to be honest with herself about that. He was experienced. He was decisive. He was also, in this moment, stretched across 6 bays with 2 residents in a staffing situation that had not been designed for 8 simultaneous critical admissions. Bay 2, a soldier with bilateral lower extremity trauma, tourniquets applied pre-hosp, field dressing soaked through. The resident assigned to him was doing the right things in the wrong order. Bay 4, a soldier seizing, post-blast TBI. She could read it from 15 feet. The nurse on him was reaching for the correct drug. She had not checked the airway first. Bay 6, Jenna working fast, working right. Madison watched her and felt something loosen slightly in her chest. Jenna was good. Jenna was handling it. Bay 3 empty for 11 seconds. Then a stretcher. The soldier on it was young, 22, maybe 23. His gear had been partially cut away by whoever loaded him into the ambulance, which meant the paramedics had seen something they needed to get to fast. His left thigh had a tourniquet. Standard issue applied 2 inches above a wound that Madison could see from the corridor was a junctional bleed femoral involvement. The tourniquet was not going to hold it. Junctional wounds did not respond to limb tourniquets. The pressure point was too proximal. You needed direct compression against the pelvic floor. You needed hands. The resident assigned to Bay 3 was looking at the chart. Madison was already inside the bay. She did not think about mast. She did not think about the protocol. She thought about the femoral artery and the rate at which a human body loses pressure when one is compromised, and the number of seconds between now and the moment the math stopped working in the soldier's favor. She put both hands on the wound. She held it. She leaned into it with her. She held it. She leaned into it with her full body weight, finding the angle, pushing against the pelvis, feeling for the feedback that told her the compression was in the right place. I need a combat gauze pack now. The resident looked at her. The foil pack on the second shelf now. He moved. She packed the wound tight 3 fingers. The technique came back to her without announcement. The way a muscle returns to a motion it has performed thousands of times without hesitation, without ceremony, with only the clean efficiency of a thing that was learned until it became reflex. The bleeding slowed. The monitor showed pressure dropping. Still dropping, but slower now. Buying time. Enough time for surgery. Maybe he needs the OR, she said. Type and cross. 2 units packed red cells on the rapid infuser. Get Hennessy on the phone. The resident was already reaching for the phone. Mass stepped into the doorway of Bay 3. He looked at the soldier. He looked at the monitor. He looked at Madison's hands, still maintaining pressure, still holding the line between this man's life and what came after it. He did not tell her to get out. He stood in the doorway for 3 seconds. That felt considerably longer. Then he said, Miller, get Hennessy. Tell him Bay 3 is going to the OR. He looked at Madison. Something moved behind his eyes. She could not name it. She did not try. He walked away. Madison held the pressure. She counted. She breathed. Somewhere down the corridor, a monitor alarmed. Someone called a name. Footsteps accelerated. The department moved the way departments move when the work is real and the margin is thin and every decision is being made at the speed of what happens next. In Bay 1, the soldier who had set her call sign was breathing on his own. His chart said his name was Specialist Aaron Briggs, 1st Battalion, 75th Ranger Regiment, Fort Benning, Georgia. Madison had not looked at his chart. She already knew his name. The soldier in Bay 3 made it to the OR. Madison watched the stretcher go. She pulled off her gloves. Her hands were clean underneath, steady, the way they were always steady when the work was real. She turned back to the corridor. The department had found its rhythm, not a comfortable rhythm, the rhythm of a machine running at capacity, every part moving, every margin thin. Jenna was in Bay 5. Miller was in Bay 2. Mass was somewhere toward the back of the unit, his voice carrying without the words being clear. Madison moved to Bay 1. Specialist Aaron Briggs was breathing. His SATs were holding at 96. The tension pneumo had resolved. His fragmentation wounds had been dressed field style, which meant someone in the field had known what they were doing before the ambulance ever arrived. She checked his pupils, equal reactive. She checked his grip. Right hand responded, left was slower but responding. She updated his chart. She did not look at his face while she worked. She looked at his face when she finished. He was watching her, not the ceiling, not the monitor, her. His eyes were clear now in a way they had not been 20 minutes ago. The fog of hypoxia had lifted, and what was underneath it was sharp and young and completely uncomfortably focused on her. "Hawk," he said again. His voice was stronger this time. Madison kept her expression exactly where it was. Neutral, professional, the expression of a nurse checking on a patient. "You are stable, specialist. You had a tension pneumothorax. It has been resolved. You are going for imaging in a few minutes." "You are Hawk," he said. "Sergeant First Class Cole, First Bat. You ran support element for Bravo Company 2018 and 2019. She wrote something in the chart. Her hand did not hesitate. Her handwriting did not change. "My name is Madison Cole. I am a registered nurse. You are at Martin Army Community Hospital. I know where I am." A pause. His breathing was controlled now. Deliberate. The kind of measured breathing a man uses when he is managing pain. "I was a private first class when you rotated out. I was in 3rd Platoon. You treated my buddy Kowalski after the Korengal contact. October 2019. He lost 2 fingers. You kept him from losing the hand." Madison closed the chart. She looked at him directly for the first time since she walked into the bay. "You need imaging," she said, "and you need to rest. Sergeant First Class Cole." He said the rank quietly, not aggressive, like a man setting something down carefully. "You saved Kowalski's hand. He still talks about you. He told everyone you just appeared out of nowhere, worked on him for 40 minutes, then disappeared before anyone got your name. He called you Hawk because that is what someone told him your call sign was." He stopped, swallowed. The effort of talking was costing him something. "Why are you here?" The question landed differently than she expected. Not confrontational, genuinely asking the way a young soldier asks something when he actually wants to understand. Madison looked at this man, 22 years old. Ranger tab on the shoulder of his cut uniform, visible under the hospital gown. The same tab she had worn for 10 years before she folded it into a drawer in a rental house in Columbus and told herself she was done with all of it. "I am a nurse," she said. "This is where I work. You are more than a nurse. Specialist Briggs." Her voice was quiet and final the way a door closing is final. "You need rest. I will be back to check your vitals." She left the bay. She walked to the supply closet at the end of the corridor. She went inside. She closed the door. In the dark, she stood with her back against the metal shelving and pressed both palms flat against her thighs and breathed. In through the nose, out through the mouth, the count she had used for years. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Release. She had been so careful. 2 years of careful, a name that was her real name, but only half of her real story. A hospital close enough to the world she had left that she could still understand the patients, still translate the injuries, still speak the language fluently enough to do her job, but far enough inside the civilian system that no one would look twice at a quiet nurse with a community college degree and a few scars she did not explain. Aaron Briggs had looked twice. Aaron Briggs had looked and seen everything she had spent 2 years making invisible and said her call sign out loud in a trauma bay in front of a charge nurse and a resident in a department that was still trying to figure out how she knew how to pack a junctional wound. She pressed her palms harder against her thighs. The door opened. Jenna stood in the doorway. She looked at Madison. Madison looked back. Jenna did not say anything immediately. She stepped inside and pulled the door halfway closed behind her. The noise of the department dropped by half. "Bay 3 made it to the OR. Jenna said, "Good. Hennessy says the femoral is repairable. He is going to be okay." "Good." A pause. "Who are you?" Jenna said, not unkind, not accusatory. The question of a woman who has watched someone do things that do not fit the folder they arrived in. Madison looked at the wall of shelving in front of her. IV bags, saline tubing, the ordinary infrastructure of keeping people alive. I am a nurse, she said. Jenna was quiet for a moment. Mass saw you pack that wound, she said. He did not say anything. I know. That is the first time I have seen him not say anything. Madison said nothing. The soldier in Bay 1, Jenna said carefully. He is asking for you by name, not your badge name. She paused. A different name. The supply closet was very quiet. I will go check his vitals, Madison said. She opened the door and walked back into the corridor. Behind her, she heard Jenna exhale, slow and long. The breath of a woman who has just realized the ground she is standing on is considerably more interesting than she thought. The afternoon shift came in at 1400 and the department exhaled. Not completely. The mass casualty protocol was still technically active, but the 8 Rangers had been distributed across the system. 3 in the OR, 2 in the ICU, 2 in post-op recovery, 1 Aaron Briggs in Bay 1 stable, waiting on imaging results, asking questions that Madison was not answering. The immediate crisis had passed. What remained was the accounting. Mass stood at the nursing station with a printed incident report form and the expression of a man building a case. Madison had seen that expression before, not on him specifically, on people who had realized they lost something and were trying to recover the position. Cole, he did not look up from the form. She stopped. The intervention in Bay 3, walk me through it. I have documented it in the chart. I am asking you to walk me through it. She looked at him. The department around them had gone selectively quiet. The way departments go quiet when something is happening that people want to witness but do not want to appear to be witnessing. Jenna was at the medication dispenser 6 feet away, not looking at either of them. The patient had a junctional hemorrhage, Madison said. Femoral involvement. The tourniquet was proximal to a wound that required direct compression. I applied combat gauze with manual pressure against the pelvic floor and held it until the bleeding was controlled enough to move him to the OR. Mass set down his pen. Combat gauze, he said. Yes. Junctional compression technique. Yes. Where did you learn that? The question landed without a question mark. Flat, precise. The question of a man who already suspected the answer and wanted to watch her navigate around it. Experience, she said. That is not a technique taught in standard nursing programs, community college or otherwise. No, it is not. He waited. She did not fill the silence. She had learned in environments considerably less comfortable than this one that silence was not a vacuum that required filling. Silence was information. What you chose to put in it told the other person exactly how much you needed them to know. Mass picked up his pen. I am filing an incident report regarding unauthorized clinical intervention. It will go to nursing administration and the department chief. I understand you overrode a physician's procedure in Bay 1 and performed an advanced intervention in Bay 3 without authorization. Both incidents will be reviewed. Both patients are alive. She said not defiant factual. That is not the point. With respect, doctor, that is exactly the point. The quiet in the department deepened. Jenna had stopped pretending to look at the medication dispenser. Mass put the cap on his pen. He looked at Madison with the look of a man who has decided the conversation is over, but has not decided what happens after it. You are on administrative hold pending review. Finish your current patient documentation and report to nursing administration before end of shift. He walked away. Madison watched him go. She turned back to her workstation and opened the chart for Bay 1. Aaron Briggs, vitals updated at 1347, imaging results pending. She began typing. Her hands did not slow down. Her documentation was precise, time-stamped, clinically accurate. She was almost finished when she heard the boots. Not one set, multiple. The particular cadence of military boots in a civilian corridor. People who walk in step without thinking about it. People for whom synchronized movement is not a choice but a consequence of years. She did not turn around immediately. She finished the sentence she was typing. Then she turned. There were 4 of them. Dress uniforms, not the everyday kind. The kind you put on when you are going somewhere that requires your record to be visible on your chest before you open your mouth. The man in front was a lieutenant colonel. Silver oak leaves on his collar, Combat patch on his right shoulder, Ranger tab above it. His name tape said Garrett. He was looking at Madison, not at Mast, who had appeared from somewhere down the corridor, not at the nursing station, at Madison specifically, with the focused attention of a man who has been looking for something and has just found it. Beside him, slightly behind, a woman in civilian clothes, late 40s, federal badge clipped to her belt. The kind of badge that did not advertise which agency it belonged to. Mass stepped forward. Lieutenant Colonel, I am Dr. Gerald Mass, senior physician. How can I help you? Garrett did not look at him. I am looking for a nurse, he said. Madison Cole. Mass paused, a half-beat of recalibration. She is currently under administrative review. If you need to speak with staff, I can arrange. I need to speak with Cole. Garrett's voice was polite and completely immovable. Now, please. Mass looked at Madison. Something shifted in his face. I am Cole. Garrett looked at her really. I am Cole. Garrett looked at her really looked. The way soldiers look at each other when they are trying to see rank and record without the markers being visible. Is there somewhere private we can speak? The family consultation room, she said. Down the hall. She led them. She did not look back at Mast. She heard him behind her, not following, just standing there. The sound of a man recalculating in real time. The consultation room was small. A table, 4 chairs, a box of tissues on the counter that nobody ever used except under specific circumstances. Madison closed the door. She sat down. Garrett sat across from her. The woman with the federal badge stood by the door. Garrett folded his hands on the table. Specialist Aaron Briggs, he said. He is stable. Imaging showed no retained fragmentation in the thoracic cavity. The pneumo is fully resolved. He told us who treated him. He told us what he called you. Madison looked at the table. He was confused. Post-blast TB, I can cause confusion. Sergeant First Class Madison Cole. Garrett's voice was not unkind. 1st Battalion, 75th Ranger Regiment, Medical Support Element, Bravo Company, 2 deployments to Afghanistan, 1 to Syria, separated October 2019. The room was very quiet. Honorable discharge, he continued. Meritorious Service Medal, Combat Action Badge. A commendation that was classified at the time and remains partially classified now. He paused. You have been here 2 years. Yes. Working as a floor nurse. Yes. He looked at her for a long moment. Briggs says you saved his teammate's hand in the Korengal in 2019. He says you appeared, worked for 40 minutes, and were gone before anyone got a clear ID. He has been telling that story for 5 years. Garrett leaned forward slightly. He also says you corrected a needle decompression in the bay this morning that would have failed and that you packed a junctional wound with a technique that is not taught outside of combat medicine programs. Madison said nothing. The woman by the door spoke for the first time. Her voice was measured, professional, the voice of someone accustomed to rooms where information was more valuable than noise. We are not here to cause problems for you, Miss Cole. We are here because of what happened today. 8 Rangers came through those doors, and at least 2 of them are alive right now in ways they might not have been. She paused. We would like to understand who you are. My record is accessible through. We have read your record, Garrett said. I mean, who you are now, why you are here, why you have spent 2 years in this building being treated as something considerably less than what you are. The questions sat between them. Madison looked at the box of tissues on the counter. She thought about Aaron Briggs saying her call sign. She thought about the soldier in Bay 3 whose femoral artery was being repaired right now 3 floors above this room because she had put her hands on him and held the line. She thought about Mast in the corridor and his incident report and the phrase community college programs. She thought about the Korengal Valley in October 2019, the ambush, the 4 people who had gone in with her and the 4 people who had not come out. I needed quiet, she said. Garrett nodded once. Slow. And now, he said. Madison looked at him. Outside the consultation room door, the department continued. Monitors beeped. Someone called a room number. Boots moved on tile. The ordinary percussion of a place where people came when they were broken and left. Most of them less broken than they arrived. She did not answer him yet, but she did not look away. The consultation room door opened 20 minutes later, and Madison walked out first. Garrett and the woman with the federal badge followed. The woman had a name by now. She had offered it quietly midway through the conversation, almost as an afterthought. Special Agent Diane Correa, Department of Defense Inspector General. The kind of title that explained the kind of badge that did not advertise its agency. Madison walked back to the nursing station. Mast was there. He was standing with his incident report form and a man Madison did not recognize. Older civilian suit, administrator's lanyard around his neck. The man's name tag said Director of Clinical Operations. He was holding his own folder. People in positions like his always carried folders when they expected a conversation to require documentation. Mast saw Garrett's uniform first. The silver oak leaves registered. His posture shifted imperceptibly, the involuntary adjustment of a man whose body remembered military hierarchy long after the rest of him had moved on. Lieutenant Colonel, he extended a hand. Gerald Mast, senior physician. We were just reviewing some departmental. I know what you were reviewing, Garrett said. He did not take the hand, not rudely. He simply did not reach for it, and the absence of the gesture was louder than anything he could have said. I would like to talk about Sergeant First Class Cole. The administrator with the folder looked at Madison. He looked at Garrett. He looked at Korea's badge. The folder closed. Of course, he said. In the course of this morning's mass casualty response, Garrett said, 2 of my rangers received interventions that the responding physicians were either unable or insufficiently positioned to perform in time. A needle decompression was corrected mid-procedure. A junctional hemorrhage was managed with combat gauze technique under direct manual compression. Both patients are currently alive and in surgical recovery. He paused. Both interventions were performed by Nurse Cole. Mast's jaw tightened. The interventions were unsanctioned. Nurse Cole exceeded her scope. Sergeant First Class Cole, Garrett said, 1st Battalion, 75th Ranger Regiment, Meritorious Service Medal, Combat Action Badge, 10 years of operational medical support in Afghanistan and Syria. She has performed field medicine in conditions that would challenge most trauma surgeons in this building. He looked at Mast directly. She did not exceed her scope. You were not aware of her scope. The corridor was absolutely still. Jenna had stopped moving. Tyler, a young resident who had arrived for the afternoon shift, stood near the medication room doorway with a syringe in his hand and the expression of someone who has walked into the middle of a film and is trying to catch up on the plot. Madison stood at the edge of the nursing station. She was watching Mast. She had imagined in a general way what it might feel like for someone else to say the things she had never said. She had imagined it would feel like relief. It did not feel like relief. It felt like standing in a high wind, like the air pressure had changed and her body was still calibrating. Mast looked at her. In that look was the full weight of 2 years. Every comment about her credentials, every redirection in front of residents, every patient given to her because they were difficult, and every meeting she was excluded from because she was not. Everything he had used to keep the shape of the department the way he wanted it. The shape that put men like him at the center and women like her at the perimeter. She looked back at him and did not give him anything. Korea stepped forward. She spoke to the administrator. We will need a room for the remainder of the afternoon. There are matters related to today's incident that require formal documentation. She opened her credentials case and laid it on the nursing station counter. The administrator looked at it. His folder opened again. His pen came out. Whatever he had come here to do with that folder, he was doing something different with it now. Mast said she filed a falsified credential history. Her application listed a community college RN program. She did not disclose a military training. Military service records are not required disclosures on civilian nursing applications. Korea said neither is prior service training. If you filed an incident report on that basis, it will be reviewed and most likely dismissed. It is not about the application. It is about the interventions today. Unauthorized. Dr. Mast, Garrett's voice was even unhurried. The voice of a man who has given orders in places where the stakes of tone were considerably higher than this. 2 Rangers are in surgical recovery because of what she did this morning. One of them is 22 years old. He has a wife in Columbus and a daughter who is 7 months old. He is going home because Nurse Cole put her hands on him and held the line until your OR was ready. He paused. Whatever paperwork you file will reflect that. I will make certain of it. Mast said nothing. For the first time since Madison had worked in this building, Gerald Mast had nothing to say. She watched the silence move across his face. not satisfaction. She did not feel satisfaction. Something more complicated than that. The feeling of a thing that has been held for a long time being set down. The ache of muscles releasing a tension they had carried so long they had forgotten it was there. Jenna appeared at her elbow. She did not say anything. She handed Madison a coffee. Black? No sugar? Madison looked at her. Jenna shrugged. One shoulder, the gesture of a woman who has been paying attention for 2 years and has finally been given permission to show it. Madison took the coffee. She turned back to the nursing station. She opened Aaron Briggs's chart. His imaging results had posted while she was in the consultation room. She read them. She made 2 notes. She flagged one result for the attending. Then she walked down the corridor toward Bay 1. Garrett followed at a distance. She was aware of him. She did not slow down. Aaron Briggs was sitting up. His color was good. The chest seal on his left side was holding. His eyes tracked to the door when she came in and then to Garrett behind her. And something moved across his young face. Not surprise. The expression of someone whose bet had paid off. You told him, Madison said. I told Sergeant Garrett you were here, Briggs said. I did not think you would do it yourself. I was not going to, I know. He looked at her directly. The clarity in his eyes was complete now. No hypoxia, no fog. Kowalski said you disappeared after the Korengal. He said you were just gone. No name, no record anyone could find. He spent 2 years looking. He paused. He is going to lose his mind when I tell him where you are. Madison set the chart down. She looked at this young ranger in a hospital bed, in a gown that swallowed him with a ranger tab on the uniform they had cut away and folded on the chair beside him, because even in a trauma base someone had thought to keep it. She thought about the Korengal, the cold, the weight of a man whose hand she had held together with what she had available, and the prayers of someone who had stopped praying but kept the habit because the counting needed something underneath it. How is he, she said. Briggs smiled. Small, real. He is a mechanic now outside Tacoma. He still has all 4 fingers. The hand works fine. He paused. He says the scar looks cool. Madison looked at the window. Outside, Fort Benning stretched flat and wide under a Georgia afternoon sky. She could see the tree line at the edge of the post, the particular shade of southern pine at 1500 hours. She had looked at tree lines in other countries with different eyes in a different set of reasons. She looked at this one and felt something she did not have a clean word for. Hawk. Briggs said her call sign quietly, not to summon her, just to say it. The way you say a word you thought you might never get to say out loud. We got you. Behind her, Garrett said nothing. He did not need to. The department moved around them. Monitors and footsteps in the ordinary rhythm of a building full of people trying to keep each other alive. And Madison Cole stood in Bay 1 and felt the ground beneath her shift into something that felt for the first time in 2 years like it might hold. The formal review took 3 days. Madison worked them all. Not because anyone told her to, because Jenna asked quietly on the morning after the mass casualty whether Madison was coming in. And Madison said yes, the same way she said everything without elaboration, without ceremony. She showed up at 6:30, checked the exits, poured her coffee black, and went to work. Mass was present for all 3 days as well. He did not speak to her directly. He moved through the department with the careful deliberateness of a man navigating a room where the furniture had been rearranged in the dark. He knew where everything was. He was no longer certain of the distances. The incident reports he had filed were under review by nursing administration. Korea had made one phone call from the consultation room on the first afternoon, the contents of which Madison did not know and did not ask about. Whatever was said on that call, the administrator with the folder had left the department 40 minutes later, without the energy he had arrived with. The folder went with him. The incident report stayed technically, but they had stopped moving forward in any direction that felt purposeful. On the second day, Tyler, the young resident, appeared at Madison's elbow during a quiet hour between admissions. He stood beside her for a moment without speaking. Then he said, "Can I ask you something?" Yes. The junctional compression in Bay 3, the angle of pressure against the pelvic floor. I have been reading about it. The technique? How do you know how hard to push? Madison looked at him. He was 28 years old, earnest. The kind of earnest that had not yet been worn smooth by the grinding repetition of years. She had seen that look before on young rangers asking questions in forward operating bases, on medics who were new to the field and were smart enough to know they did not know enough. You feel for the feedback, she said. The bleeding tells you when the pressure is right, the rate changes. You have to stay in contact with the wound and listen with your hands. Tyler wrote something in the small notebook he kept in his chest pocket. He looked up. Listen with your hands, he repeated. It sounds simple. Does not sound simple at all, he said. And he walked away. On the third day, Garrett came back. He came alone this time. No uniform, dark civilian clothes, the kind of nondescript that people who spend time in operational environments wear without thinking about it because blending is a habit. He found Madison in the break room at 11:30 eating a sandwich over a chart, and he sat down across from her without asking if the chair was taken. She looked at him. Korea finished her report. He said, I figured. The incident reports mass filed have been dismissed. Nursing administration reviewed the clinical documentation for both interventions and found them within scope given your documented training background. They are amending your personnel file to reflect your full service record. Madison set down the sandwich. I did not ask for that. No, Garrett agreed, but it is accurate, and accurate records matter. You know that. She looked at the chart in front of her without reading it. There is more, he said. There usually is. He put a folder on the table. Not a thick folder. 3 pages, she could see the edges. He did not push it toward her. He left it on the table where she could reach it or not reach it, according to her own decision. The 75th Ranger Regiment has a medical advisory program, he said. Civilian consultants, former service members who provide training and protocol development for forward medical support. It is a part-time role, 8 weeks per year. You would stay in your nursing position. Nothing changes here unless you want it to. Madison looked at the folder. You could also do nothing, Garrett said. You could stay exactly as you are. Nobody is asking you to put anything back on that you took off. He paused. But Briggs is going home next week. Kowalski called him yesterday. Apparently 4 times in one day, because Briggs had not told him fast enough. Kowalski would like to speak with you when you are ready. He let that land. And there are Rangers training at Harmony Church right now, and next month, and the month after. Young soldiers who will go to places that do not have this building available to them, who will need someone who knows how to listen with their hands. The break room was quiet. The refrigerator hummed from the corridor. The ordinary sounds of the department drifted in, muted by the closed door. Madison looked at the folder for a long moment. She thought about the Korengal, not the way she usually thought about it, the weight of it, the loss of it, the 4 names she carried like stones in her chest. She thought about what came before the ambush, the months of work, the hundreds of decisions made in the field that nobody documented and nobody decorated and nobody ever saw. They kept people breathing long enough to get somewhere that could keep them breathing longer. The work that happened in the gap between the wound and the hospital was 7 months old. She reached out and was 7 months old. She reached out and picked up the folder. She opened it. She read all 3 pages. She read them the way she read everything, completely without expression, absorbing each word before moving to the next. When she finished, she closed it. She picked up the pen from beside her chart. She signed the last page. She handed it back to Garrett. He looked at the signature. He nodded once. There is one more thing, he said. He reached into his jacket pocket. He set something on the table between them. Small, a unit coin. She recognized it without picking it up. The 75th Ranger Regiment. The scroll, the colors, the coin she had earned years ago and left behind, along with everything else she had decided she was done with. She picked it up. It was heavier than she remembered, or she was remembering wrong. Some things felt lighter in the past than they actually were, and you only understood the true weight of them when you held them again. Briggs wanted you to have his, Garrett said. He said he would earn another one. He said this one belongs to you. Madison closed her hand around the coin. At 1400 that afternoon, Mass called a department staff meeting. Mandatory. Madison arrived with her coffee and stood near the back of the room with Jenna, who had developed over the past 3 days the habit of standing near Madison in the way that people stand near things they have decided matter to them. The meeting began with standard department updates, staffing, protocol revisions, supply chain issues with a particular suture material that had been on back order for 6 weeks. Then Mass set down his papers. He looked at the room. He took his time doing it. He was a man who had spent his career in the front of rooms, and he understood rooms. The way they breathe, the way attention moves in them, the way silence can be used. I want to address the events of 3 days ago. He said the room went still, in the particular way it goes still when people suspect they are about to witness something they will be talking about for a long time. 8 Rangers came through this department in mass casualty conditions. The team responded effectively. Several people performed above the standard that a situation like that demands. He paused. His eyes moved across the room and found Madison. He held the look for 2 full seconds. I made errors in judgment during and after that response. I made assumptions about competence based on credentials I could see, rather than capabilities I had not taken the time to understand. Another pause. That is not a standard I hold others to, and it is not a standard I should have held myself to. The room was completely silent. Mass was not a man who apologized. Everyone in that department understood this. The way you understand is something about the weather, a fact of the environment that you work around, rather than question the fact that he was doing it now in front of the entire staff without minimizing, without redirecting, without the lawyerly qualifications that people use when they want credit for an apology, without the cost of one, landed in the room with the weight of something genuinely rare. "Nurse Cole," he said. Madison looked at him. "I filed 2 incident reports based on a misunderstanding of your background and training. Those reports have been withdrawn. Your clinical decisions during the mass casualty response were sound. They were more than sound. Were not." The room breathed. Jenna made a "were not." The room breathed. Jenna made a small sound beside Madison. Not a word. The sound of air leaving a chest that has been held tight for 3 days. Madison looked at Mass for a moment. She thought about 2 years of quiet cuts. The meetings she was not invited to. The comments in front of residents. The word community and community college degree said the way you say a word when you want it to carry more weight than its definition. She thought about all of it. Then she said, "Thank you, doctor." She said it without coldness, without performance, without the satisfaction of a wound repaid. She said it because it was the right response and because she had spent enough of her life carrying weight that did not belong to her, and she was not interested in adding his to the load. Mass nodded once. The meeting continued. After, in the corridor, Tyler appeared again. "Can I ask you another question? You are going to whether I say yes or not." He almost smiled. "How did you know in Bay 1 that the needle angle was wrong?" "You saw it from across the room." Madison walked toward the nursing station. He followed. "I have done it enough times that wrong looks wrong before I can explain why." She said, "That is what experience is, not a credential, not a certificate on a wall. It is the accumulation of every time you have done the thing correctly and incorrectly until your hands know the difference before your brain does," Tyler wrote in his notebook. "And how do you get that experience if nobody lets you practice?" Madison stopped walking. She looked at him. He was genuinely asking. Standing in a hospital corridor with a notebook and a pen, and the look of someone trying to figure out how the world actually works beneath the version it presents in orientation packets. "You practice everything they do let you do," she said, "until you are so good at the things they give you that they have no reason left to keep the other things away." He wrote it down. Madison watched him write. Something moved in her chest, not large, not dramatic. The small, specific feeling of a thing finding its place. She thought about what Garrett had said in the break room. Young soldiers who will go to places that do not have this building available to them, who will need someone who knows how to listen with their hands. She thought about Tyler in this corridor in 3 years or 5 in a room, somewhere with his own hands and his own decisions and whatever accumulation of experience he had managed to build in the time between now and then. She said, "Tomorrow morning, arrive at 600 before your shift starts. Bay 3, I will show you the junctional technique on the simulation model properly with the anatomy reference, so you understand what you are compressing and why." Tyler stopped writing. He looked up. "Yeah," he said. The word came out smaller than he intended. "Bring the notebook." She walked to the nursing station. She opened the board. She reviewed her patient assignments, updated her mental map of the department, noted 2 vitals that needed rechecking before end of shift. At 17:45, she walked down to Bay 1. Aaron Briggs was being discharged tomorrow. He was dressed in civilian clothes now, sitting on the edge of the bed with his discharge paperwork on his knee, reading it with the expression of a young man trying to understand every word of something he did not fully trust. He looked up when she came in. Hawk, Madison, she said. That is the name. He considered this Madison. She pulled the chair to the bedside and sat down. This surprised him. She could see it. She had not sat down with him before. She had come in, checked his vitals, updated his chart, answered his questions. Standing, the posture of someone passing through. She was not passing through. Kowalski, she said, tell me about him. Not the hand, him. Briggs looked at her for a moment. Then he told her. He told her about Kowalski, the mechanic who lived outside Tacoma with a truck that was always half assembled in his driveway, and a dog named Corporal, and a wife who had married him, knowing exactly who he was and loved him anyway. She listened the way she had learned to. She listened the way she had learned to listen in cargo bays, in forward operating bases, in the particular silence of places where what was not said was as important as what was said completely, without waiting for her turn to speak. When Briggs finished, she sat with it for a moment. Then she said, give him my number. Briggs went very still. When you get home, she said, give him my number. Tell him it is all right to call. Briggs looked at her. His eyes were doing something she recognized. The particular brightness of someone who is holding something together because the alternative is making a scene, and Rangers do not make scenes. He will call a lot, Briggs said. That is all right. She stood. She picked up his discharge chart from the tray. She checked the boxes she needed to check. She signed where she needed to sign. She put the chart back. She looked at him one last time. This young ranger in civilian clothes in a hospital bed, going home to a wife and a daughter, and the long work of carrying what he had been through without being crushed by it. You did good out there, she said. In the field before the ambulance. The tourniquets were right. The field dressings were right. You kept your guys alive long enough to get them here. Briggs pressed his mouth into a line. Ranger training, he said. Yes, Madison said. And whoever taught it to you. She walked to the door. Madison, his voice caught her at the threshold. She turned. Thank you, he said. For Kowalski, for today, for all of it. She looked at him. Get home safe, specialist. She walked out. The department was moving around her. The last hour of the shift, the gentle decompression of a building settling into its evening rhythm. She walked to the nursing station. She picked up her coffee, cold now, and drank the last of it without complaint. Jenna appeared beside her. Briggs is going home tomorrow, Jenna said. I know. You going to be okay with that? Madison looked at her. 2 years of mornings and difficult admissions and masked and black coffee in the work. 2 years of Jenna making eye contact after the hard moments and asking with her eyebrows whether Madison was all right. She had never answered honestly. She answered honestly now. Yes, she said. I think I am. Jenna looked at her for a moment. Then she reached under the nursing station counter and produced 2 paper cups of coffee from the pot she had clearly made in the last 10 minutes. She set one in front of Madison. Then let us finish the shift, she said. Madison picked up their coffee. She looked at the board, her patients, her department, the bright blue scrubs she had worn for 2 years in a building where she had been invisible by design, and where she had decided, somewhere between a needle and a coin, and a young resident with a notebook, that invisible was no longer something she needed to be. In the fluorescent-lit ER of a Fort Benning military hospital, Madison Cole spent 2 years choosing invisibility, short answers, quiet steps, head down, letting a bitter chief physician reduce her to just a community college nurse without ever raising her voice in protest. She absorbed every sideways comment, every redirection in front of residents, every assumption that her worth stopped at her badge because she had already carried heavier burdens in places where silence wasn't weakness. It was survival. 10 years as Sergeant First Class in a Special Operations Medical Support Element had taught her that real strength doesn't announce itself. It shows up in the dark, in the dirt, holding a teammate's life together with whatever hands and gauze are available, refusing to let go even when the world is exploding around you. She became a nurse not to hide but to keep doing the only thing she knew how, stand in the gap between wound and death, no matter how small the room or how ordinary the uniform. Then 8 Rangers rolled through the doors after a training explosion. Blast injuries, junctional bleeds, tension pneumos, the exact patterns she had memorized in blood and sand. When one of them, fading on the table, looked up and whispered her old call sign, Hawk, the mask cracked. She stepped forward, corrected a failed needle decompression mid-procedure, packed a junctional wound with combat gauze under direct pressure, held the line while everyone else recalculated. She didn't do it for recognition. She did it because that's who she had always been. The person who refuses to look away when a life is slipping, even when staying quiet would be easier, safer, less painful. This story reaches deep because it reminds us of the people we pass every day. The quiet coworker, the unassuming neighbor, the one who never makes waves, and never asks what wars they've already fought inside themselves. We judge by what we see, the degree on the wall, the title on the badge, the volume of their voice. But Madison shows us that the deepest strength often lives in silence. It's the refusal to disappear when it would be simpler, the steady hand that reaches when others have turned away, the choice to keep showing up even after the world has tried to make you forget who you are. Some carry medals they'll never wear, scars they'll never explain, names they'll never speak again. Yet they still save lives, still teach the next generation, still stand in the gap because stopping isn't an option. The lesson isn't just about hidden heroes. It's about how much we lose when we stop looking for them. When we assume the quiet ones have nothing to say, we miss the ones who have already said everything that matters with their actions. If this story stirred something raw in you, if it made you think of someone you have overlooked, or a part of yourself you've kept buried, please share it in the comments below. Tell me, who in your life has surprised you by being far stronger than they ever let on? What quiet strength have you carried that no one ever asked about? Your words might be the exact thing someone needs to feel seen tonight. And if stories like Madison's are raw, real, reminding us that the bravest hearts often beat the quietest, move you deeply, hit subscribe right now and turn on notifications. We bring you these tales every week because the world needs more people who refuse to walk past the invisible ones. You're not alone in feeling the weight. Thank you for being here. Keep watching. The quiet ones are often carrying the heaviest light.